CoxHealth is a large not-for-profit health system, and we're based in Springfield, Missouri, but we serve nearly 1 million people in 25 counties of Southwest Missouri and Northwest Arkansas. We have 5 hospitals in our system and over 80 physician clinics.
When a person comes into the hospital, they expect to come in, get treated, and go home well. The Hospital Engagement Network fit well with a lot of things that we were already doing.
Do you need to go somewhere?
We were already working on falls, and this gave us an opportunity to network with a larger group of individuals to get their lessons learned, to share what we found successful and to learn what they found successful.
One of the things that we learned from the HEN was the importance of that frontline staff engagement.
Remember, our goal is to reduce our falls by 40%.
And so on the individual units, we have unit-based councils that work together with leadership to help identify what are their barriers and also looking at some of these new strategies.
Now, since he's fallen,
We're currently trialing bed mats that they lie beside the bed, and so if a patient does fall, it'll prevent injury. We're also currently trialing raised toilet seats. That way they don't have to sit so low and then possibly get off balance.
But I have some questions yet to ask you about your fall risk.
We issued a gait belt for every staff member on the unit, so they wear that. So when they're in answering a call light or rounding on their patients, then the patient needs to go to the bathroom. It's easily accessible.
We have a red magnet program, so we put a red magnet on the door of a patient who's at high risk. We've developed an agreement with the patient. It's actually an agreement that they sign that verifies that they understand what we've taught them in terms of how to prevent them from falling.
If we do happen to have a fall on the unit, the charge nurse will gather the staff that were involved, the patient, if there's family members, and they will go over just exactly what happened.
You weren't dizzy when you got up?
What was the situation? What was the environment? We reflect on processes. What could we have done different? What wasn't in place that should have been in place?
You could use the communication board.
And it just helps us with seeing what we need to put into place in the future.
Yes.
The data that's provided through the Hospital Engagement Network and that our employees collect is important in driving change.
And this is our quality improvement model.
You don't understand or can't see what you need to change unless you know what the data is.
Had a steady decrease in our number of falls.
In the past 2 years, we've had a 33% reduction in our falls, which correlates to 73 falls were prevented. And falls with injury, we had a 23% reduction. So with the reduction of falls, we really do feel like celebrating.
You've seen a 23% decrease in falls.
It's exciting to see the numbers going in the right direction. We feel like we have momentum. We feel like we're going to continue to see the numbers decrease. And it gets our staff more excited, more engaged, and really builds pride.
Thanks for tuning in to HNHN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.